White fungus and COVID-19, is this a myth or a reality? After black fungus, the white fungus is constantly reappearing in recent days. As the problem is not so dangerous, but its complications in immunocompromised persons need serious attention. Also, the different colored fungus and its relation to COVID-19 creates a huge dilemma among the sufferer. The white-colored sore occurs on the patients, called a white fungus. But there is no specific cause behind it. Mainly the color of the fungus depends upon the growth of the fungus, as it shows some minor symptoms like a sore in the esophagus, difficulty in swallowing food, and some rare patches around the mouth. But symptoms like multiple intestinal perforations are the most severe consequences of white fungus nowadays. Who are in the risk groups? The people having low immunity, like the people who are recently suffering and recovered from COVID-19, have the greater chance. Taking steroids among people leads to white as well as black fungus too. Besides that, the patient having chronic diseases like diabetes and cancer have a higher risk. In addition to it, people with organ transplants, chemotherapy, HIV, and bone marrow transplant come under this risk group. What is the cause of white fungus? White fungus is nothing but candidiasis. It is also not more dangerous than black fungus mucormycosis. These molds of white fungus live in soiled water. So, poor sanitation is the main reason behind this. What are the warning signs of white fungus? The warning signs are like sore in the oral cavity, pain in the one side of the face, loss of vision or diminishing vision, difficulty in swallowing, ulcer in mouth. Other signs and symptoms are like pain in the sinuses, affect the brain, discharge from the nose. Some symptoms are the same like COVID-19, but the test result shows negative. Also, some intestinal complications are like multifocal intestinal perforation, ulcer in the intestine, multi-organ failure. Why the intestinal complications were seen in white fungus? The causative organism like Candida does not put a serious impact on the intestine. The normal flora of the gut easily deals with it. But there are some immune-suppressive factors like steroids and broad-spectrum antibiotics that cause many complications. They help the infections to grow unusually. Because of it, the fungus can penetrate the thin layer of the intestine. It goes deeper and reaches the body tissue, and last creates multifocal perforation in it. Other parts of the body that are mostly affected are genital areas. What are the diagnostic evaluations? According to experts, the white fungus can cause severe lung infections. So, a chest scan or X-ray can reveal the severity of the infections. Sometimes the CT scan of the abdomen helps to predict the intestinal perforation. A biopsy of the abdominal tissues helps to detect ulceration and intestinal perforation. Also, the microscopic examination under 10% potassium hydroxide can be used to detect it. How do we manage it? As per the clinical basis, the white fungus is less dangerous than black fungus. It can be easily manageable by drugs like fluconazole, amphotericin B, voriconazole, echinocandins, and posaconazole is highly recommended. Have to develop better immunity to protect yourself from this kind of infection. Also, good sanitation and proper indoor ventilation are required for precaution. Maintaining personal hygiene and keeping good control over your diabetes helps you to get over it.